Welcome to another episode of the Tobago House of Assembly's Post-Executive Council Media Briefing. This week, the Secretary of Health, Wellness and Family Development, Dr. Agatha Carrington, addresses the media.
As Secretary for Health, I'm responsible for health and wellness, public health and family development. And so the areas that I'll speak to are categorized under those three headings. Permit me to therefore share in terms of health and wellness. In terms of health and wellness, I want to point to a most recent improvement that we have experienced in our emergency room at the Scarborough General Hospital. That area has been challenged over time in terms of the long wait time our clients face, and therefore within the past week we have redesigned the service. And so we now have categories 4 and 5. Those non-emergency cases are now managed separately, and the emergency cases are managed in the trauma area, resulting in a reduction in the wait time. We look forward to measuring those results, but from the anecdotal data that we are seeing and the comments from our clients, there has been positive feedback in terms of those improvements. And so we want to thank the new leadership of the Scarborough General Hospital and the teams for the efforts in terms of improving the wait time in the emergency room at the hospital. The second area I want to point to under health and wellness is our efforts towards improving our infrastructure. And you may recall that we turned the sod for the start of the Moriah Health Center. Those works are expected to commence shortly, and you may recall that we mentioned that that facility will cost us $28 million to be delivered in 18 months. Just a few days ago, the team from UDCOT visited on the leadership of the Honorable Prime Minister, and we visited the site for the new Roxborough Hospital. The RFP is now out for the design, build, and equip model. That's what we're using. The expectation is that we will commence this project by 1st June. As I continue on the health and wellness, and these are some areas I would want you to save the dates for. We expect to roll out our men's health service in Louisdor. So we will be hosting our men's health service, or pink room, women's health, or pink room we call it. And women will now be able to have that service available in East Tobago within the month of March, commencing the month of March. Another area that we are delivering on the health and wellness, and this is for adolescent health services, the living room, we call it DE, living room. And that is also to be rolled out in March in our Lowlands facility, because we feel that adolescent health is an area that requires our attention. The other area I want to point to under public health, a few months ago we would have improved our fleet of vehicles, where we handed over 9 vehicles such that we can improve our delivery of services to our community of Tobago. And at that time, we handed over backhoe truck, buses, and so on. It was important to do that because we wanted to improve the fleet available to those staff to do the outreach that is required for our population. Now what we have done is to improve the fleet by 1. We now have a cesspool tanker to support our efforts to improve the efficient disposal of liquid waste. And so that has been added at the cost of $750,000. It's a most useful piece of equipment as we seek to improve our public health response to our population, ensuring that they are much more equipped. The other area I want you to save the date for as well is that our off-site record center is now finished and waiting to be opened. And this area is an area in which we have organized our staff records, both daily and monthly. This is one of 2 sites that are to be rolled out. The other area I want to point to for you to save the date for as well is our distribution of REACH grants. This is where we will distribute seed capital at the rate of the sum of $7,500 each, and persons will benefit from the seed capital as they seek to realize those ideas they have for small businesses. Just permit me again to continue on the area of family development. Two important areas that we are addressing at this time. The community of differently abled persons. We are now fully organized in terms of the staffing or the composition of that committee, the Tobago Coordinating Committee for the Differently Abled, and those persons will soon receive their instruments, allowing them to continue working on and behalf of differently abled. So to the elderly, those members of that committee, they have been also approved, and they will soon be receiving their instruments such that they continue to do work on and behalf of the elderly. Let me just also mention a couple of other areas that are important as we seek to respond to the needs of our population. And this is our second edition of our outreach to communities, and so today we go to Palatuve. This is our second edition of our community participation in the planning process. We go to Palatuve such that we can get feedback from those persons in the community of Palatuve as they seek to give their input for our plans for the year 2019-2020. So that is expected to continue.
I wanted to find out when exactly is there a date available for when the record center will be opening?
We requested a date from some of our colleagues so that they can participate in the process. It's ready for opening, and so that we expect that we should have a date this month. Ideally, we would want to have all of these areas for which I asked the save the date to be no later than 31st March. So that from now, as soon as we can have not have a clash of dates, we will have those.
Okay, so the schedules are still being worked
out in terms of what dates, and that's why I asked that people just be on the lookout so that we will have those coming. Okay. So the rest of this month of February into end of March, we should have our dates there.
And has there been any feedback as to any margins of improvement that have been observed at the Accident and Emergency Department in terms of time?
And that's why I said anecdotally. We've not, because it's just 1 week, we've not measured it, but based on what the feedback has been, persons are expressing that now they no longer wait as long. The issue is that persons who are not or non-emergency cases are now filtered. So we have created a filter, and those persons are processed quickly and dispatched. Those that require much more urgent intervention, those are managed in the trauma area. So that it allows for us to concentrate on those emergency ones in a separate area, while the doctors deal with the lesser emergency ones, and they are discharged.
Could you tell us how many doctors and nurses are assigned to the accident and emergency?
The number of doctors at the present time, there are 17. And I think the number of nurses would be of the order of 25 or so, maybe more.
But how many of them would be on active duty on any given night or day?
For any given night or day, you will see rostered an SMO, a registrar, and of the order of 5 or 6 house officers. In the morning, you will have that. It will not or ought not to fall under at least 4 house officers and a registrar and an SMO on any one day.
Why I'm asking is because in recent times, I've had to be at the accident and emergency department, and there was not sufficient staff.
Have you gone there recently? Have you gone there within the past week?
Not since the end of January, no.
Okay, so I encourage you to visit.
So the circumstances have all changed now.
May I say that, and let me correct, I'm not sure, you said you visited and this is what occurred. You ought not to have any shortage of staff in any unit or department of the Tobago Regional Hospital in terms of doctors and nurses. We are properly staffed and overstaffed with nurses and doctors. And so I'm not sure why you didn't see doctors there when you wanted the number of doctors you wanted to see.
There were actually 2 doctors on call, and there were 3 nurses.
That ought not to be, because you have more than 200 nurses, nearing 200 odd nurses in our facilities. So maybe we have to ask them to look at how they allocate staff.
I could probably give you the dates.
Okay, there's no secret that we spend most of our budget on staffing. There's no secret. And so one would want to ask, why do we spend so much if the bodies aren't there? Yes, our expenditure each month is of the order of $28 million. So that we have the staff, and I encourage you to visit again, and you will experience something better.
A different experience this time.
I'm sure. Yeah. That's what we spend per month, most of which is for staffing. So it's of that, about 90% is for staffing. It's extremely high. And overall, if you look over the entire year, our staffing cost is 85% as against 15% for goods and services. So the ratio is skewed to our human resources, and you ought not to have a difficulty in terms of staffing.
When you spoke about the family development, you mentioned community, you mentioned the differently abled staff. They will soon receive their instruments of appointments? They
will soon. We created the committee, and their instruments will soon be handed out to them. We expect to do that by the end of this month.
Right. So that's a completely separate body from everybody else.
The Committee for the Disabled, they have the responsibility for managing those issues with respect to the differently abled. It's made up of the differently abled persons, visually impaired, Down syndrome, autism, hearing impaired. Those groups are represented there.
Secretary, could you just tell us a bit more about the women's health services that will be available in Louis d'Or? Some of the services that will be offered, would it be at our community center, that environment, and
So let me just say that an area that is not adequately served is that with respect to our women. And we felt that if we provide early screening, mammograms and so for women, and just allowing them to come to a space where you have women's issues being addressed, we felt that that is an important intervention. There are two areas that are to be designed for that service, one of which is the Louis d'Or site, and the other the Old Fort. The Old Fort is to be refurbished, so you'll have a pink room in that area, and you'll also have one for East Tobago. If you know where the ambulance bay is, where the health center is in Louis d'Or, all right, so that the building that is on the incline, just above the ambulance bay, that is the building. So we have a consultant on board already to come to provide the services for the women of East Tobago.
And could you just remind me of the deadline by which you said we'd be made privy to these dates? Was it by the 1st
I have asked my Chief Secretary to provide us with some dates, and I expect that we will start rolling out these between this month and the end of March, no later.
The Moriah Health Center, has the building actually started?
No, they have mobilized. We have a meeting tomorrow at 1 o'clock, and we will be provided as to what day they'll start digging ground. We expect that would be within this month. There were some early challenges in terms of location of the contractors' space for work, some access issues, some site issues that had to be resolved. And so that has delayed the startup of the project. But the project is to move ahead.
So 18 months from whenever they start,
yes.
That's when it's going to be finished?
Yes.
Okay,
I expect that they will have to accelerate, because time lost was not really our doing.
Thank you for staying with us for the Tobago House of Assembly's Post-Executive Council Media Briefing for the week ending February 16th, 2019.